Hello and welcome. It's so great to have you here with us. I'm excited to talk to you about something that we at the Impulsivity Online project feel so passionate about. We are passionate about providing evidence based support to use the best possible approach to help you achieve your health goals. As well, we are in a fight against the stigma associated with eating disorders and obesity, and we believe in health in all its shapes. Whilst most people overeat on occasion, when it becomes a pattern of behavior that starts to cause serious consequences in a person's life, or to their health or mental health, they may be struggling with a serious condition called binge eating disorder. If you recognize that you might have a binge eating disorder, it's a good idea to see a doctor or a clinical psychologist for a proper diagnosis. As well, if you think that you might be struggling with other issues, chronic or acute stress, depression, or any other mental health issue, please seek help. Don't prolong your suffering. People with binge eating disorder eat large quantities of food within a fixed period. For example, within 2 hours, at least one time a week for 3 months or more. They feel a loss of control during these episodes, distressed after the episode, and report three or more of the following: eating more rapidly than normal, eating to the point of physical discomfort, eating large quantities of food when not hungry, eating alone to avoid embarrassment, feeling depressed, disgusted, or guilty after eating. Now, ask yourself the following questions. Do you eat large quantities of food in a short amount of time? Do you feel a loss of control over your eating? Do you eat even when you're not hungry or keep eating when you have had enough? Do you feel uncomfortable or guilty after eating? Do you hide how much you eat from others? What of these stood out for you? Did you answer yes to all these questions or only some of them? If you answered yes to all of them, please consider seeking your doctor to get a proper assessment and treatment. And if even you answered only some of them, there is something to be gained by looking at impulsivity or the cycle of impulsivity. So, why do we look at impulsivity? It's because research is overwhelming on the role impulsivity plays in the development and maintenance of unhealthy eating habits. Let's have a look. Impulsivity is perhaps the most important trait to consider for binge eating and associated eating disorders. Impulsivity is a personality characteristic that potentially has crucial consequences for the development and maintenance, as well as treatment of obesity. It's interesting to note that individuals with high impulsivity demonstrate weight gain across their lifespan. According to developmental theories of personality, impulsivity begins to emerge in late infancy and early childhood and persists into adulthood. There is a decline in impulsivity that happens as we age. However, if we are higher in impulsivity as adolescents, we are more likely to be more impulsive as adults. This indicates that impulsivity is an enduring trait that may serve as an important health risk indicator in relationship to obesity. So, academics have been researching the link of impulsivity and binge eating for a while. So, let's take a look at the cycle of impulsivity. An impulse is defined as a sudden, strong urge to act, and impulsivity is acting on this urge. Everyone experiences impulses, several each day. Some are helpful, like an impulse to duck when something is thrown in our direction, an impulse to call a friend who we haven't spoken to in a while, or an impulse to hold the door for someone who is carrying a heavy item. Other impulses are not as helpful. We know the difference because acting on them leads to consequences. These consequences can be to our health, our mental health, our finances, work, relationships, or any other part of our life. Often, these impulses are related to the pain pleasure principle. For many, the diagram on the screen represents the cycle of impulsivity. We experience a strong urge or impulse. We act on this urge. feel guilty, and experience negative consequences as a result, and then make promises to change our behavior or to justify and excuse our behavior, but ultimately experience some sort of stress and repeat the cycle again. Here is why it's difficult to manage impulsivity. Are you more likely to impulsively drink when you experience positive or negative emotions? Well, do you ever feel like you don't want a party to stop or to miss out on the fun? Are you ever the last man or woman standing when everyone else has gone home and you're still at the bar? In this case, you are more likely to be influenced by positive urgency. If you are more likely to drink when you feel depressed, angry, ashamed, or embarrassed, then it might be due to negative urgency. Recent studies show that emotions play a far more important role in influencing our eating habits than gender difference, restraint, or weight status. In a sample of 779 European people, anger and joy were more likely to be associated with emotional eating habits rather than sadness and fear. A recent study indicated that the quality of emotions contributes essentially to the degree and the structure of emotion induced changes of eating. In comparison, the influences of individual characteristics, such as gender, restraint, or weight status, seem to be rather weak. Anger, as compared to other negative emotions, possibly plays a major role in emotionally elicited binge eating. Binge eaters described anger or frustration prior to a binge 42% of the time, but sadness or depression only 16% of the time. Does this mean that we need to find a way to manage our anger in a way that does not lead to unhealthy eating habits, in particular, binging? The tendency to seek out novel and exciting stimuli. Who do we think about when we consider sensation seeking? We think about risk takers. We think about people who are adrenaline junkies. The presence of a certain kind of dopamine receptor is also associated with a sensation seeking people, more commonly known as risk takers. If we see something as a reward, we want to move closer towards getting it. If you feel rewarded by a slice of cake, you will make a move towards getting it. So, one of the ways to try to reward yourself would be to want something else more than you want food. For example, wanting to be healthy, fit, live longer, and be strong. So, here's a tip: never reward yourself with food. You will always crave food a bit more, and it might lead to further overeating. Of course, lack of planning can create an issue when we are trying to overcome our unhelpful eating habits, or in fact, any habit. It's important to think about the negative consequences of your decisions. And when we plan, we need to plan on what we need to buy, what we want to eat. What do we do when we go to a Christmas party or office party? Plan well and have a couple of options. You know the feeling when you need to do something really important, but all of a sudden, all you can think about is binge watching the latest Game of Thrones season, or suddenly, instead of doing an assignment, you need to check what's in the fridge. Impulses to avoid. We get distracted. We might forget. It might seem too hard, and we might give up our pursuit for better eating. So let's take a look at what some of the researchers have said about impulsivity. Now, tell me, what do you notice first? The carrot or the chips? What about now? The broccoli or the slice of cake? A study published in 2015 in Health and Psychology magazine reports that people who are at risk, people who are obese, are more likely to detect high calorie foods. And in our society, we are constantly bombarded with advertisement for chocolate, chips, and junk food. And if attentional bias is already present, then that is what we're going to notice the majority of the time when we are more likely to choose the food that might not be the best for us. So, do you feel addicted to food? Because if you do, you might be right. We might experience symptoms like addiction when we struggle with overeating. We might obsess about certain food, feel that we don't have control over it. We feel low because we can't stop overeating. Researchers call it cue reactivity. People who have other dependencies experience similar symptoms. Studies show that one of the biggest issues when we are impulsive is actually that we don't think about the negative consequences of our eating in the moment when we are about to eat something. In some cases, people experience a dissociation when they are about to binge. So, one of the best things you can do for yourself is to think about your future and that that food is not good or bad, it just is. The problem with impulsivity is that it's such a robust trait that we can't just shake it off or just meditate on it and get better. We need to keep on monitoring it and our habits and see if we consistently can make good choices. It doesn't mean that you need to restrict yourself. Not at all. Just simply focus on nourishment first. Check how you feel. Are you still hungry? And if so, is it emotional or physical hunger? By the way, we don't have a lot of time, but make sure that you check out our blogs on binge eating as well to learn the difference between emotional and physical hunger. Lastly, we might struggle to achieve our goals as impulsivity always sabotages our progress. It makes it difficult to resist cravings and temptations. So, for that reason, we designed this program for you to help to be in control of your overeating once and for all. Another study investigating delay discounting in obese individuals demonstrated that obese women, when compared to non obese women, demonstrated greater discount for delayed rewards, thus preferring smaller, immediate rewards rather than delayed, larger rewards. It's interesting to note that individuals with high impulsivity demonstrate higher weight gain across their lifespan. Previous studies have consistently demonstrated a link between impulsivity and increased weight gain over time. And usually, we don't crave celery or kale. We crave highly palatable food. And we have an abundance of highly palatable food marketed to us. It's much harder for us to control our temptations for sweet, sugary, or fatty food when we have poor self control. Poor results outcome when we are trying to lose weight. Impulsivity is not only responsible for us putting on weight, but as well, it has been shown to be a poor predictor of treatment outcome during weight loss intervention. So, in defense of impulsivity, there is such a thing as functional impulsivity. It can give us greater enthusiasm, greater adventurousness, rapid decision making, idea generation, extroversion. Though dysfunctional impulsivity has rapid but inaccurate responses, being disorderly, ignoring facts when making decisions, ease of distraction, suicidal thoughts. At times, survival can actually be dependent on the choice of smaller rewards sooner rather than larger ones later. For example, a starving animal might have to take a small amount of food immediately to ensure its survival, rather than wait for larger prey later. Similarly, people might learn as well to use smaller rewards sooner rather than larger later. For example, it's possible that in countries torn by war, people experiencing economic and political instability might choose immediate small rewards to ensure their existence rather than larger ones later, as there is a real possibility that they might be worse off from waiting for these larger rewards. So, let me introduce our program where we support our clients in addressing dysfunctional impulsivity when they decide to help themselves in creating better lifestyles. As you can see, impulsivity is complex, and we understand how hard it is for you to manage it well. So, we decided to help you by putting everything we know into a course to help you achieve your goals. Beat the Binge includes modules on self compassion, relapse prevention, emotional regulation, and body positivity. As well, we encourage our participants to reflect on their own behavior and to see how it can be applied in their life. By the way, it's important that you seek professional medical advice if you suspect that you have a binge eating disorder or other eating disorder, as you will benefit from a comprehensive assessment and treatment plan. Additionally, if you struggle with severe depression, anxiety, and other conditions, make sure that you seek help for those first and consult with your doctor if binge the bit and consult with your doctor if Beat the Binge is the right program for you. It's important to understand that impulsivity is not just about acting quickly, as you've learnt today. It's about a lack of planning, using maladaptive strategies to manage emotions. It's about food used as a reward and all the different ways impulsivity negatively impacts on our lifestyle and positive relationship with ourselves and food. We use the principles of cognitive behavioral therapy in our program. CBT is considered to be an effective treatment in a number of conditions. It can teach you to rethink some of your unhelpful thinking patterns, create better habits, identify unhelpful thinking patterns that sabotage your progress, and teach you how to replace it with better and more helpful suggestions. Sometimes we justify overeating, and other times we beat ourselves up. Both strategies aren't helpful. We can show you a better approach on how to deal with it. Mindfulness is a great practice to help you to understand your emotions, feelings, and sensations without having to react to them. Not only will we teach you on how to practice mindfulness, we will provide you with a library of exercises which you can access at any time. It has been shown that acute stress has been contributing to the overestimation of time and might be a contributing factor to the exacerbation of impulsive behaviors, especially binge eating. For this reason, we have a bonus part on stress management as well as body positivity, relapse prevention, all to help you to have a complete kit to stop the binges. Furthermore, stress interacts with impulsiveness, placing individuals at a higher risk for engagement in addictive behaviors. We've discussed today how particularly important negative feelings are in influencing our overeating. So, emotional regulation is important in helping you to stop overeating if you feel angry, depressed, or ashamed, or experience any other difficult feelings. Here is a slide for as an example for what our course looks like. There's information and videos on everything. There are some worksheets that you can download to enhance your learning. There's a library of mindfulness exercises, including urge surfing, which has been used by many health professionals in helping clients to navigate their urges and triggers. In the courses, we as well have a downloadable book, which is included for free for people to download and use on their laptops or in a print format. The same book is on Amazon at the moment. We are trying to accommodate all clients' needs. And we do check in with you, offering advice, support, and answer all questions that might be needed. So, in summary, there are more than 25 lessons, 22 worksheets, a library of mindfulness exercises, easy access from anywhere, and you have our support if you need any information. Feel free to reach out to us at hello@impulsivity.com.au if you have any questions. But in the meantime, check out our website at www.impulsivity.com.au. Thank you for coming and listening, and please let us know if you have any questions.